born a healthy baby. He looked just like every other healthy baby. But when Sam turned 8 months old, he started to look different from everyone else. He started to lose his hair, get thin, and he started to look older than all the other babies. What was wrong with Sam? Sam had a premature aging disorder known as progeria. This is Sam. Although none of you know anyone like Sam, you could have a child just like him. Like many of you, I do not know anyone with this disease, but I have done a lot of research on it. Therefore, my purpose today is to inform you of 3 important categories of progeria. These categories are the definition of victims, history, and effects. Pediatric dermatologist J.I. Harper states in his article, Hutchinson-Gilford Progeria Syndrome, that clinical findings in 3 patients carrying the G608G mutation in LMNA and the review of literature from 2007 that the definition of progeria is a rare, premature aging disorder. According to Dorothy B. Villey, George Jr. Nichols, and Nathan B. Talbot in their article, Metabolic Studies in 2 Boys with Classical Progeria from February of 1969, they develop normally for the first few months of life. The effects don't become evident until they are 6 months to 1 year old. The victims. Again, Harper writes that 1 per every 4 to 8 million births occurs in progeria. R.L. Pollux and R.A. Hegel state in their November of 2004 article, Hutchinson-Gilford Progeria Syndrome, that there are over 100 cases since 1986, and there are currently 40 known cases worldwide. There have been 116 progeria patients found by the Progeria Research Foundation, declares Tina Heisman-Say in her article, Rare Disease Sets Mom's Research Agenda, written February of 2003. Now that I've discussed the definition of victims, I'm going to talk about the history of progeria. According to the National Institutes of Health in their article Progeria, written March 15th of 2007, in the 1990s, not much was discovered on progeria. The diagnosis was on physical symptoms such as skin change and the fact that they didn't gain weight. There was no treatment or cure, and they found that Hutchinson-Gilford was the most severe type of progeria. According to Heisman-Say, in 1998, the cause was unknown to why these kids were aging so fast, why they were dying of heart attacks and strokes, and how to treat the disease. In 1999, Leslie Gordon's son was diagnosed with progeria. She then founded the Progeria Research Foundation to help build resources to study cell and tissue banks. The article Progeria again states that in the early 2000s, genetic and lab tests became available. The lab tests showed that the LMNA gene produces abnormal lamin A protein. Researchers found this is caused by alters in the genetic material of the lamin A. Farnesyltransferase transferase inhibitors, which are originally used for cancer, reverse dramatic cell structure for kids with progeria. They also found the mouse model to help experiment therapies. Today, researchers have hope due to early studies of human and mice blood vessels. The article Hutchinson-Gilford Progeria Syndrome confirms that researchers found progeria is 1 in 9 disorders that has to do with the lamin A gene, which is the stability and strength to all genes. Now that you have learned the definition and victims and the history of progeria, let's look at the effects that it has. It has both external and internal effects. The article Rare Disease Sets Mom's Research Agenda states that externally, Sam was growing abnormal. His teeth didn't come in and he was becoming stiff. The article Metabolic Studies in 2 Boys with Classical Progeria vows that patients may be bald by the age of 2 with no eyelashes and no eyebrows. Their body fat disappears and they become thin. As Harper notes, they have protruding ears, their scalp veins show. They begin to look aged. They have a horse riding stance with their knees slightly bent, not standing straight. The National Institute of Health writes that they have slow growth rate, making them shorter and weigh less than the average child. Internally, Heisman-Say declares that their arteries harden due to not having high cholesterol. According to Harper, their joints become stiff, and most die as teenagers by the age of 13 due to cardiac and cerebrovascular complications because of premature atherosclerosis. The article Metabolic Studies in 2 Boys with Classical Progeria states that their skeletal bones change. Their bones become thin. They have small clavicles. They have defective hardening of the skull and costa valga. Pollux and Hegel declared that by the age of 10, they have the respiratory, cardiovascular, and arthritic conditions of a senior citizen. In conclusion, there are many important factors of progeria. Its definition and victims. It's a rare premature aging disorder that affects children by 6 months to 1 year. It occurs in 1 per every 48 million births, and there are 40 known cases worldwide. Next is its history. In the 1990s, there was no cure or treatment, and they found that the most severe type was the Hutchinson-Gilford. In the early 2000s, genetic tests became available, showing that this was caused by small mutations in the lamin A gene. Today, progeria is 1 in 9 disorders to do with the lamin A gene, and they have hope in a cure. Last is its effects. Externally, they lose their hair and their scalp veins begin to show, and internally, their arteries harden and their bones become thin. Now that you know the seriousness of this disease, if you're ever encountered by a child with progeria, don't judge them. Although none of you have progeria, you could have a child just like Sam.
Is progeria passed down from parent to child?
No, it's caused by their genes, a mutation in it.
When are the earliest symptoms shown?
6 months.
How many people are affected?
Every 4 to 8 million.
How many cases are there right now?
40.
How is progeria diagnosed?
By their physical symptoms.